Hey everybody, it's Dr. Nicole Bonner, and today we're going to talk about why just masking the pain is not correcting the source of your problem or the source of your condition. What does that mean? Well, we all know, this is no big shock to you, that when we take a medication, that medication is only masking the symptom that you have. Think about it. Let's start with the easy one, pain. You wake up one morning and you have neck pain and it's radiating up into your head, and let's say you have a headache. So what do? Well, you take an Advil or a Tylenol, some kind of pain reliever, some kind of anti-inflammatory, correct? Well, you got to realize, I think everybody realizes this by now, but if you don't, you have to realize that that anti-inflammatory is only temporarily taking the inflammation down from whatever is causing the pain to begin with. Have you ever asked yourself, actually, I was just having this conversation with a friend of mine. She's on a medication, but she's asking her doctor, why is this happening, right? And the doctor has no answer. They're just like, take this medication. And that was not even a pain issue. That was a systemic issue. But have you ever asked yourself why? What happened on the inside of here that caused the pain to begin with? Because that's a really important question to ask, because the medication, it's not solving your problem. It's just masking the pain. You and I think, can pretty much agree with that. If you agree with that, write in the comments, agree. If you don't agree with it, let me know that as well, because I'll explain it a little bit further. Let's take it the next step further. Let's take it as a head cold. I've been suffering the last week with some kind of head cold. My body, I guess, has been run down. It hasn't been fighting some kind of virus or bacteria that I came in contact with. And I've been feeling pretty crappy the last couple of days. Thank God I'm getting back on my feet. But when we take a medication for a head cold, and don't get me wrong, here's my disclaimer. I'm not telling you not to take medication. That's not what this conversation is about. But what I am telling you is to realize that that medication is not curing your cold. It's only temporarily handling the symptoms of your cold, right? If you have a stuffy, runny nose, the medication is only temporarily shutting down certain systems in the body to shut down the expression of a runny nose or a sneezy nose or a cough or something like that. Your next question should be is, why would you want to shut that down anyway? That's a question for a whole nother video, because that expression of coughing, sneezing, runny nose is actually your body's way of healing itself from whatever virus or bacteria or parasite it's trying to fight. Whoa, that's a mind blower now, isn't it? Let's take it even a step further. Let's say there's a systemic problem like high blood pressure. You go to the doctor, your blood pressure is high. They give you no explanation as to why your blood pressure is high. Most likely, if you do ask, they're going to come back and they're going to say something like, oh, it's your genetics, right? How many of you guys heard, oh, it's your genetics? And that's their explanation as to why your body is not functioning properly. Let's all agree that if something in your body is running too high, or if something in your body is running too low, let's agree that that is a function problem. The body is not able to keep itself in balance, in homeostasis. We all learned that word in 5th grade science. Do you guys remember it? If you remember it, say, I remember in the comments, right? All right, so let's get back to our story here. So let's say you have high blood pressure. You go on the high blood pressure pill, and the high blood pressure pill is a chemistry that affects the chemistry in your body that takes the blood pressure down. Great. Did that pill cure your high blood pressure? Put the answer in the comment. And the obvious answer is, of course it didn't. Why? Because if you were to stop taking that blood pressure pill, what's going to happen to your blood pressure? It's going to shoot right back up. Your medical doctor knows it. Why? Because you say, Doc, oh great, I'll take this pill, but how long do I have to take it for? And what's the typical response? For the rest of your life. Why? Because the pill is not curing the disease. The pill is not creating balance in your body. It's just handling the symptom in that moment. Does that make sense? If it makes sense to you, write in the comments, it makes sense. And thanks, by the way, for subscribing to our channel and following us. Hopefully this information is providing you a ton of value. So then the question is okay, doc, I understand what you're saying. I'm on board with what you're saying, but what do? I can't live with high blood pressure. I can't live with my thyroid not working properly. I can't live with my pancreas not producing insulin. What do I do? Well, that's where chiropractors really shine. And chiropractic is not a cure or a treatment for any of those diseases. But what chiropractic does do is by having regular chiropractic care, it allows the brain, which is your master communicator, it is the master controller of all of the other organs. The brain is what is responsible for keeping the body in balance, right? You guys remember the biofeedback loop? Once again, 5th grade science, the biofeedback loop, that's all controlled by the brain. You guys remember that? So the brain controls the body by sending energy or electrical signals through the spinal cord. Now, the spinal cord is housed in bone. It's actually not only housed in bone, but it's attached to bone. We call those bones spinal bones or vertebrae. Now, when the vertebrae are in good alignment, meaning they're stacking up one right on top of another, the spinal cord can be nice and relaxed. And the messages from the brain can quickly pour through the spinal cord, allowing all the organs to stay in balance. And if they're not in balance, it actually allows the body to work toward getting back into balance. However, when the spinal bones shift out of their normal alignment, it causes a massive amount of stretch to the spinal cord. When the spinal cord stretches like a rubber band, the velocity or the speed of the nerve impulses from the brain into the body start to slow down. And when the nervous system slows down, guess what else slows down? You're right. Everything else in the body slows down because everything relies upon the brain to function properly. Now, when the body starts to slow down, then it starts to get out of balance and it can't adapt to the stress in its environment. Does that make sense? Let me know if that makes sense to you. And when the body starts to get out of balance and it's left uncorrected, over time, the body will start to create these dis-eases or this dysfunction, like thyroid dysfunction, pancreas dysfunction, cardiac dysfunction, you name it. All right. So what am I telling you here? What I'm telling you is that your chiropractic adjustments are not the treatment for your disease, but the chiropractic adjustments, as they restore the function to the nervous system, the body will be able to heal itself and will be able to restore and regain balance. And in many cases, many patients over the years have been able to either reduce the amount of medication that they have to take or get off the amount of medication that they have to take completely. And everybody, the way that they heal, of course, is different. You know that. So, with that being said, I hope this information blesses you. I hope this information is of value to you. And more importantly, I hope this information starts the conversation in your mind to start asking questions on how you can help your body to heal and function better. Please subscribe or follow for more.